Next, we have Denise Fromm.
Hi, my name is Kevin Fromm. Our Zoom is under my wife's name, Denise, and I will be reading a statement today on behalf of a parent who is unable to attend this session. My name is Heather Fraser Isifan, former Captini, unable to be here today because I'm a nurse and I need to work. My younger son is suffering. He is also experiencing depression, and this is happening because his severely mentally ill older brother is not receiving the mental health treatment. His family is continually traumatized in our home. His older brother does not get the care he needs, and I have exhausted all resources per community mental health, CPS, and the court system. We currently live in Shiawassee County, and the former sheriff, Mr. Beagle, is also our state representative. He may recognize my son's last name, as the police, sheriff, and state police have all responded to calls for my eldest son's mental health crises multiple of times since we have become residents of the county. At this time, when we call 911 for help to keep us safe, Central Dispatch notifies both the local police and the 2 state troopers to respond to the severity of our eldest son's mental issues and his resulting actions. My eldest son has been in the care of community mental at Shiawassee Health and Wellness, as well as Genesee Health Services, and private psychiatrists and therapists since the age of 3. That is almost 12 years. He has multiple diagnoses: autism, DMDD, which is dysregulation disorder or disruptive mood dysregulation disorder, major depressive disorder, anxiety, suicidal ideation, and psychosis at times, and he was most recently given the diagnosis of conductive disorder, a severe mental that all people with antisocial personality disorder have as children. We colloquially know antisocial personality disorder as sociopathy. To give you an idea of what that means, my son has been in intensive care for cognitive behavioral therapy most of his life. He has done ABA, the gold standard therapy for autism, twice with no results, and we are about to start a 3rd time. He does have a RAP team and is in special education for emotional impairment. He has been on dozens of medications for his mental health disorders, big antipsychotics, and continues to be on them now. Abilify, Risperidol, Haldol, Zyprexa, Triliptol, Depakote, just to name a few. While we have continually sought intensive therapy and the right medication for years, he is still uncontrollable. I have begged for residential care because he is dangerous. I have been continually denied. We are refused the intensive residential placement the psychiatrist has requested since June of 2020. In that time, he has masked multiple assault charges. The police have responded for hitting a teacher in the head with a rock, causing great bodily harm, for assaulting people with deadly weapons, for attacking police officers, for attempting to get police officers' guns twice, for physically assaulting me, and I have 3 herniated discs in my neck from one assault, for assaulting his stepdad, assaulting his biological dad, assaulting his grandfather, assaulting his brother, assaulting other children in the community, and assaulting other teachers. I have pictures of the results of the assaults: punches, kicks, digs, bites, and strangulation marks, should anyone want to see them. In that time, community mental health points its finger at the justice system, and the justice system finds him incompetent to face his charges and points the finger back at community mental health. No one will help him, so the entire community continues to suffer. My eldest son is released back to me immediately after arrest and refusal of placement, and I am told to do my best to keep him safe. When the justice system did his competency evaluation for his first felony assault, they found in 1 year that he had been to the ER 19 times for placement, many of those times escorted by the police, and no one was willing to accept him, even in crisis or short-term inpatient, because of his violence that required physical and chemical restraint at the hospital. He has been to the ER with police escorts dozens of times. We are begging for help before my son, who has exhausted all resources according to medical professionals and the justice system, costs someone their life. Each time he is arrested, we go to the hospital just to be released back into the public because no one will help us. Per Judge Gadola in Genesee County Court, January of this year, 23, she said, "Mother, I would just continue to encourage you to pursue services." Mrs. Bates' input, Mrs. Bates is the juvenile delinquency caseworker in Genesee County, is that you have done everything you can, probably above and beyond, to try to help your son. Just please keep doing that. Since that court date in January, he has assaulted me, my husband, a Durand police officer, bad enough to injure him and cause destruction to police property in one incident as well, and attempted to take control of a vehicle to kill me and my younger son, in which it took 5 officers to catch him and get him under control. So here I am with other parents struggling, publicly addressing this issue with people with the most power. Please help us, since community mental health will not. Please help us keep my son from harming others, harming someone else again, or worse yet, our police department being scrutinized in the court of public opinion for doing what they very well may have to do someday to keep the community safe. Since we pay for both publicly and privately are obstinately choosing not to do their job. Please choose today to save not only my son's life, but our community and our officers. There is only one way this will end without placement for my eldest son. Thank you for taking time to listen.
Thank you for providing that testimony.